I have given name of or listed name of antacid. There are 4 different types of antacid which are available for the treatment of hyperacidity in the GI tract. And the example of these drugs including sodium bicarbonate, calcium carbonate, magnesium hydroxide, aluminum hydroxide. In the slide I have shown few very common adverse drug reactions which we will discuss in the later slides when we are discussing adverse effects in journal. Okay? These are just for your convenience that most common adverse effect due to a particular type of antacid is listed in this slide. Now, what are the uses of antacids? These are used for centuries for the treatment of dyspepsia and acid peptic disorder. They were the mainstay of treatment for acid peptic disorder until the advent of PPI and H2 receptor antagonist. And once the efficacy of PPI, as it is seen, comparatively more greater, and it has a very to the point mechanism of action. For the reason PPI was replaced with all the previous medication including antacid as well as H2 receptor antagonist. If we talk about mechanism of action of antacid, it is very simple and you already know about the mechanism because this is practically you perform in your chemistry lab, in your early classes, in your school classes, as well as in your intermediate, that all these antacids are weak bases. And in the GI tract there is hyperacidity or HCl is excessively producing. So these weak bases, or whenever there is acid and base reaction will take place, the synthesis and production of what? Salt and water take place. In case of these antacids, salt and water will synthesize by the same phenomena which you already know, that they neutralize acidity by this mechanism. If we talk about efficacy of antacid, the efficacy depends upon its capacity to neutralize HCl. Usually, when we are going to take food, it will stay for at least 2 hours to metabolize and to digest in your GI tract. For the reason, if the food is there and we are going to take antacid, that will provide a better duration of time to stay in the GI tract and neutralize the acidity which is producing during digestive process. Okay, is this clear? Among the list of antacids which we have discussed in the previous slide, there were 2 main antacids which are commonly used nowadays. One is aluminum hydroxide, another one is magnesium hydroxide. Magnesium hydroxide is responsible to cause diarrhea. That is one of the important adverse effects of this type of antacid. While aluminum hydroxide is opposite this effect by inducing constipation. So what scientists synthesized and what pharmacists did in this, they combined both the salts, aluminum hydroxide and magnesium hydroxide, to synthesize a new product which is the combination of both, and it will neutralizing the adverse effect of each other. One is constipation, other one is diarrhea. Is this clear? Calcium carbonate, when react with HCl, the thing which is synthesized is carbon dioxide and calcium chloride. And it is also a commonly used preparation, not only used for the treatment of acid disease, but it can also use in osteoporosis to minimize the risk of fractures and bone degradation. Now come to the dose of antacid. A single dose of 156 milli-equivalent of antacid given 1 hour after a meal. If you recall the mechanism of action and efficacy of observed, I said that it is efficacious if it is given within the time when we are taking food. Why? Because food will stay in your GI tract for at least 2 hours, and when we are taking antacid, the efficacy and effectiveness of this will increase due to the presence of food, and its neutralizing ability will also enhance. Is this clear? So same is written over there. A single dose is given 1 hour after meal, not before meal. Sometimes people will also take before meal, but 1 hour after meal will help to minimize acidity even after digestion. 2 hour के लिए रहेगा. However, acid neutralization capacity among different proprietary formulation of antacid is highly variable. Although it is written that 1 to 2 hours its duration of action, but acid neutralizing capacity can variable if we are using different product. For example, हम prefer करते हैं कि international को अच्छी brand हो वो use करें. अच्छी brand definitely, if you are paying more, you will get more results. It is true. वो कहते हैं कि neutralization capacity is also depending upon the type of formulation. Either it is in tablet form or in a liquid form. Liquid form will provide more surface area. There is no need for the dispersion of contents. While in the tablet form, there is need to disperse the content first and then remove them from the additives which are attached with it, and then drug will able to produce its effect. So efficacy is depending upon the proprietary product, as well as it depends upon the type of formulation given to use for the minimization of acidity. Now one by one we are going to discuss the different 4 different types of antacid. The first one is sodium bicarbonate. Sodium bicarbonate. So sodium bicarbonate, which is example is baking soda and Alka-Zester. This is the product with the brand. Not available might here, but it is not a local product. It is the brand name of international product. It reacts rapidly with hydrochloric acid and produce ultimately carbon dioxide and sodium chloride normal salt. So the adverse effects which are associated with the liberation of these two, or with the synthesis of these two products, one is carbon dioxide, another one is sodium chloride. Carbon dioxide will result gastric distension and belching. What is belching? Belching क्या होता है और gastric distension. Sodium chloride is readily absorbed because it's a normal salt, and usually it is present in your liquid compartment in all over the body, causing metabolic alkalosis when given in high doses or to patients with renal insufficiency. So due to sodium chloride, which is effectively absorbed from the GIT lining, metabolic alkalosis is the common problem when it is taken in high doses, and to the patient with renal insufficiency it can create trouble. Sodium chloride absorption may exacerbate fluid retention. If you know the phenomena of osmosis, when the things are highly concentrated in one compartment and other side is low concentration, so the movement of water and fluid will take place in the opposite direction. So it will ultimately result retention of fluid in the patient with heart failure, hypertension and renal insufficiency. ठीक है? Calcium carbonate, example of calcium carbonates are Tums and Oscal. These are the brand preparations. And less soluble, react more slowly than sodium carbonate with HCl to form carbon dioxide and calcium chloride. These can also be used as calcium supplements for the prevention of osteoporosis, which I discussed in the beginning. Adverse effect due to production of carbon dioxide will remain, say that there is gastric distension as well as belching, and it is again a chloride type. So metabolic alkalosis is the common problem that will arise with the AntAcid preparation. Calcium carbonate is used for a number of other indications apart from its AntAcid properties. Excessive dose with calcium containing dairy products can lead to hypercalcemia, renal insufficiency and metabolic alkalosis. If you know that calcium can coagulate renal area, it can also coagulate not intestinal but vessels. So that will ultimately means making a plaque in the surface. So that will narrow the arteries and ultimately sometime breakage of the arteries will result coagulation and platelet aggregation process, and that may lead to hypertension and thromboembolic disorders. While in case of renal area, if it coagulate over there and it clog over there, it will definitely make a stone formation. So it is recommended not to use along with the excessive dairy product because they are increasing the level of calcium in the body. Now come to magnesium hydroxide and aluminum hydroxide. Example of these medications are Melox and Mylanta. Mylanta is commonly used in, I think, in every home. Isn't it or not? Have you seen HCl for magnesium chloride and aluminum chloride along with water. So the problem which was arising due to calcium carbonate and sodium bicarbonate, that is belching and gastric distension, that is not occurring with the use of these two combinations because carbon dioxide production is not available and not observed in because of the change in the salt. Because no gases are generated, so belching does not occur. Metabolic alkalosis is also uncommon because of the efficacy of neutralization reaction. Unabsorbed magnesium salt may cause an osmotic diarrhea, and aluminum salt may cause constipation, which I told you in the beginning of the lecture. And caution in renal insufficiency, as both are excreted from the kidney. If the kidney functions are not proper or under compromise, so there may be increased level of these salts in the body, which will create trouble. So it is necessary that doctor should be advise such person to minimize the dose or to minimize or to use or replace with some other drugs which are safer as compared to this. And all of you know that PPI are more safer because their elimination is not taking place through the renal area but from the GI tract. So these are considered as more safer and more prompt in action. Now come to drug interaction or drug-drug interaction. These interact with other by binding, reducing absorption and increasing pH of weakly basic or acidic drug. Is this clear? Their interaction, reason of interaction, how they produce their interaction by binding, and reducing absorption and increasing pH of weakly basic or acidic drug. Okay, that is the main reason of its interaction. So what kind of drug which can be affected when the person is using antacid? One is tetracycline, fluoroquinolone, itraconazole and iron. So what strategy should be used to minimize drug-drug interaction, not only in the case of antacid but other medications too which are having interaction, to increase the dose interval between the two different medications. Sahi? Means if you are using in the morning at 8 p.m. any other medication you need to use, and if you need to take antacid or any other drug which can make interaction, but safe side, polypharmacy is always avoided. What is polypharmacy? When the person is using multiple drugs at simultaneous times. So it is always advisable, whether you know the interaction or not, it is necessary that you need to make a gap between the different class of medication and different doses to minimize and to reduce completely drug-drug interaction, and same is true in case of antacid.